Hello, everyone. Lovely souls here. Welcome to this joining community, joining hands community, and welcome to this community on the topic of past life regression. I'm Dr. Ameeta Thacker, and I'm a homeopath, a clinical hypnotherapist, and a past life regression therapist. I am here for clarifying all the doubts, queries that you may have about this topic of past life regression. Well, past life regression is not something as a topic or as a concept unknown to many. It's quite known in the last few decades. However, as much as it is known and popular, there are quite a few myths revolving around it, quite a few doubts, queries that many of you would be having. And I'm here to help you out, to sort out any queries, any doubts that you may be coming across in understanding this concept. So keeping this in mind, I have collaborated with Joining Hands to really come up with this series of talks on what is past life, why do we do it, what do you expect, what do you not expect, so on and so forth. And let's start today's topic with what is past life regression. Past life regression is about regressing into past. So simple. When we talk about past, it's about recent past, remote past, and remote could be going back as far as your childhood, early childhood, intrauterine, or maybe across lifetimes. And when we talk about regressing into the past, we are talking about regressing into an experience of the past. So let's say if we have an experience where we are not getting a desired outcome, which is something in the recent past, what would you like to do about it? You would want to go back, cognitively remember that experience and anything to do with that experience, vis-a-vis thought, vis-a-vis feeling, vis-a-vis emotion, or even a perception of it, go and make a change so that you could have a desired outcome. It's simple, logical way of dealing with an experience to get a desired outcome. However, many of the times we come across situations and experiences that keep repeating despite our best of the attempts to going back and resolving it, and which continues to remain as a pattern in different areas of life. And that's where that experience keeps you stuck, which is where there is a requirement for one to go into regression. So when we talk of regression, regression is different from recalling or remembering. When we talk of correcting a recent experience, we are looking into our cognitive memory and going and checking and connecting and correcting it. But when it comes to memories that are lost, forgotten, that you have no clue of, and there are many a times memories that you have never even imagined it could be, or rather you don't even know it's a memory, they still tend to have an impact on your present. And which is where there is this need for past life regression, or which is what one does in past life regression, regressing into those memories which are lost, forgotten, and which are called as repressed memories. So when you go back into those repressed memories and you relive those memories and release the trauma, which is impacting in your present moment, in your present situation, in your present experience, in any area of the life, is where or is what we do in past life regression. And there are different ways of accessing it, because we are accessing that zone of the mind which is kind of not recognized in our cognitive memory, which is long forgotten, which is a repressed memory. There is a way to access it. And hence, there are ways to deal with that memory. There are ways to access that memory, deal with that memory, and do a therapeutic intervention, which is when we call that as a past life regression therapy. So past life regression is all about just regressing into the past. And when we do it with the therapeutic intervention, it is past life regression therapy. When I talk of repressed memory, and in the context of psychology, it's in sync with the collective unconscious or the personal unconscious that one is not aware of. And accessing those zones is simply what we do in the regression work. In other words, everything that one is unconscious of is made conscious. To quote Carl Jung, the most renowned psychologist, when he talks about the role of unconscious to conscious, which means whenever the unconscious is not brought into consciousness, it continues to direct your life, and it continues to direct your life, and it continues to remain as a fate or a destiny. So in other words, past life regression is that tool for one to get conscious of the unconscious, conscious of the unconscious, lost, repressed memories, which are experiences buried deep down in your psyche, and they still have an impact on your present. And because the present is impacted by those past experiences, there is a need for one to regress into past life. And it could be, as I said, past maybe 5 months, 5 years, 15 years, maybe in the intrauterine or across lifetimes. Now, when we talk of regression, what actually are we regressing? Is our body regressing? No. What is regressing? It's mind regressing, or you through your thought and your feeling is regressing or going back into an experience. And which is why it is called as regression, because it's reliving those experiences. So this is in short about what is past life regression. It's not about you getting transported into some other land or some other area, but it is about you through your mind doing a kind of a time travel. Or in other words, it's actually traveling into your subconscious or diving into your unconscious. So at this point, I'm going to round up this topic and wrap it up. If there are any questions, you can please put on the chat. I welcome each one of you to put your queries, doubts on the chat box. And if there's anything that you would like to clarify, there are a whole lot of topics that I'm going to take up from here onwards. Today being the first session, I'm very happy that so many people have joined. So thank you first and foremost. Well, to be here on this platform, Hitesh, and the Joining Hands community for really bringing me to this platform and inviting me to bring more light to this topic. Yes, Hitesh.
Do anybody have any questions about past life regression? We're going to do a series of short videos with Dr. Ameeta talking about past life regression, how it helps, what it can help for, who can do it, who can't do it, at what stage of your life should you do it, and more around those. So if you have questions, please feel free to ask. If you don't have questions, we can come back next week. You can post questions on the community page, and then we can answer them later on.
May I ask a question?
Sure, Sandhya.
What is the need? When do you feel that it is needed? Past life regression is needed. How do I understand that about myself? That itself, I'm sorry, my video is just not coming on. That's why I'm not on video. Sorry, Dr. Ameeta. But,
no, it's okay. So I would be addressing why of past life regression in the immediate next session, which is next Tuesday again.
okay.
Yeah, and if you would, if I don't know if you were present from the beginning, and I actually started with sharing that, let's say if you have an experience, let me repeat it quickly what I meant to say. Okay, the answer was pregnant in that experience, what I told you. If you have an experience and if you want to make a change in that experience because it's not giving you a desired outcome, let's say it happened something few days back, right? What would you do? You would go and check yourself. What did I think? What did I feel? What did I look at it? What did I not look at it, right? And that's where you want to kind of go back and rearrange your thought, feelings, and emotion to bring to some desired outcome, which means you're using your cognitive memory and your logical sense to bring a change. But many a times when there are experience, which despite doing all this, you can't get head and tail out of why it is still repeating in your life. And there is a pattern to it, is where there may be most likely a need for regression therapy. Yes, Sandhya?
Okay.
Does
Yeah.
that give you some clue?
Yeah, partially it does, but okay.
I think you'll have to be patient for the next session.
Yeah, that's what I realized. That's why I said I'll keep short. Thanks. Thank you.
Thank you for being patient. But the reason we've kept it as a short, short discussions on one topic at a time and one aspect of it is because to get more concise, at the same time more precise, and give you enough time to take all your questions from your own question bank in your mind and write to me before I meet you next. So when I prepare for my next class, I would definitely make note of your questions and give you as many examples or maybe as many simple ways of understanding.
Okay. There's one last question in the interest of time, Dr. Ameeta. Will everyone regress or someone may not?
Well, most of them can. And why would some of them not? Is because of a certain inclination. So there would be someone who would be very, very resistant or would not be believing it or would not be ready for it. However, having said that, in the same breath, I can say there have been few patients who are not believing it, they have still regressed. So there's never a blanket situation that everybody would be able to regress, because it's always individual how much you can get regress, to what you can get, what extent one can get regress. But one definitely would be able to regress, is for sure. Now, when you ask me this question, to what extent what you're expecting the regression can happen will be very individual from case to case. So regression is a very individual experience. And it will require few ingredients for one to really be able to regress to what they really would want to address. So this is the starting point for it. Followed by that, there are few things that we keep as a checklist. And when I take that topic, who are the people and who are the candidates and who are the ones who are less likely, I'll definitely include that as a topic to discuss, and we can have that discussion again.
Sure.
Okay.
Thank you.
Thank you, Chaya.
So I'm going